Health authorities in South Sudan battling both measles and yellow fever outbreaks. Doctors Without Borders raising the alarm over the situation, noting that 90% of children in the country are not vaccinated against these diseases. This year, over 12,000 cases of measles have been reported across the country. And to talk about this, I'm joined by Zakaria Mwatia from Doctors Without Borders. Zakaria, thanks again for being with us. Such an important issue. Just maybe give us a status update on why the country and its citizens who are affected by this find themselves in this particular position. We know that there are issues around security. We know that there are issues around, millions of people needing things like humanitarian aid. So the situation just overall sounds quite dire. But some of the specifics relating to why this threat now exists.
Yeah, currently the situation in South Sudan, as you mentioned, is very dire. Yeah, the vaccination coverage has been low for many years because of the health systems is not very strong. So most of the time, we need vaccination coverage of above 95, not to have a disease outbreak like measles. But now the coverage has been very low because of the health system is not strong, and it involves a lot of factors involved in terms of security, in terms of training of staff, in terms of supply of vaccines, and maintaining the cold chain all the way. So the population is facing a lot of challenges in terms of access to healthcare and access to vaccination in the entire country.
It's so sad, again, Zakaria, and I just feel for you and your teams that work in these environments, and of course, the people themselves. If you think about what you're sharing, 90% of children not having received a measles vaccination, but children under the age of 5 also just dying from a disease that can be vaccinated against and that can be prevented. It must be really heartbreaking being in those environments and encountering children, who are now experiencing this health compromise.
Yeah, it's very challenging because in most of us Doctors Without Borders, we work in areas where health communities have been excluded from health because of various factors. So where we are currently working in Western Equatoria, most of the facilities are not functioning. Most of primary healthcare centers, they don't have staff, they don't have drugs, and the physical infrastructure are depleted. They are not in good condition. So all this we experience, and what we see on the ground is that many people have to walk long distances to access the care. For instance, the ongoing measles outbreak, we are receiving many patients from far-flung, hard-to-reach villages, and many are missing to reach us because of the distance and because of the terrain. The access is very difficult.
So since the start of the year, over 12,000 of these cases reported. You've just shared with us really difficult conditions under which people can access healthcare, if at all. Talk to us about what you are able to do and just some of the challenges dealing, with the symptoms and the way that measles and yellow fever presents at the same time.
Yeah, so we face a lot of challenges in terms of transporting materials to those regions which are affected because there is very poor network, road network, and even communication is very bad. So we face a lot of challenges, and those facilities where we are intervening now, also as I have mentioned, access is very difficult. And therefore, patients are arriving in very bad condition, in very severe conditions. So it's a very tough job to start resuscitating and to start to bring them back to a health situation. So the teams on the ground have to travel long distances to go and reach the communities, providing health education and educating them to bring their children to the clinics and to the hospital where we are supporting. So it's a very hard terrain to reach the...
All right. A little bit difficult in terms of signal there, but a really, really terrible situation that Zakaria Mwatia from Doctors Without Borders has been sharing with us. The concurrent outbreaks of yellow fever and measles causing a major burden on what is already a threadbare health response system in the region, compromised by and compounded by poor infrastructure, the far-flung regions that where people might have to be treated, the difficulties with bringing children to healthcare, and then spreading the message on the vaccination campaign.